Before you begin, make sure you are prepared. Check the expiry date. Confirm the label shows Ozanta semaglutide injection. Wash your hands thoroughly. Gather materials: Ozanta pen, new needle. Remove the pen cap. Ensure the liquid is clear and colorless. Attach a new needle securely by pushing and turning until it is tight. Remove both the outer and inner needle caps. Before first use, perform a flow check to ensure the pen is ready. Turn the dose selector until the flow check symbol appears. Hold the pen with the needle pointing upward. If needed, gently tap the pen so any air bubbles rise. Press and hold the dose button until a drop appears at the needle tip. Turn the dose selector until the dose counter shows 0.25 milligrams or 0.5 milligrams as prescribed by your doctor. Ozanta can be injected into the abdomen, thigh, or upper arm. Avoid injecting too close to the navel. Clean the chosen injection site with an alcohol swab and allow it to dry. Insert the needle straight into the skin at a 90-degree angle. If advised by your doctor, gently pinch the skin. Press and hold the dose button completely. Once the dose counter reaches 0, continue holding and slowly count to 6. Then remove the needle from your skin. After your injection, carefully remove the needle. Put the pen cap back on. Store the Ozanta pen as directed. Before and after first use, store the pen at a temperature between 2 degrees C to 8 degrees C. After first use, the pen can be stored for up to 56 days, either refrigerated at 2 degrees C to 8 degrees C, or at controlled room temperature, below 30 degrees C. Always use a new needle for each injection. Read the full instructions for use leaflet for complete guidance before using the pen. With proper use, Ozanta can be a simple and effective part of your routine. If you have any questions, consult your doctor.